What is QAPI? QAPI is quality assurance and performance improvement. It is a data-driven and proactive approach to quality improvement. It combines two approaches: quality assurance, QA, and performance improvement, PI. QA is a process used to ensure services are meeting quality standards and ensuring care reaches a certain level. What is your responsibility as a home health agency has to do with QAPI? Well, according to the Texas Administrative Code Rule 558.287, this rule explains to you what your role is as a home health agency and how you are supposed to conduct yourself as an agency in regards to your QAPI. Okay, if you look here on Rule 558.287, Quality Assessment and Performance Improvement, QAPI program, an agency must, remember, whenever you see must, M-U-S-T, you must maintain a QAPI program that is implemented by a QAPI committee. The QAPI program must be ongoing, focused on client outcomes that are measurable, and have a written plan of implementation. The QAPI committee must review and update or revise the plan of implementation at least once within a calendar year, or more often if needed. The QAPI program must include, so it goes down to tell us what your QAPI program must include. As far as your QAPI setup and system, the Texas Administrative Code tells you pretty much what that consists of. A system that measures significant outcomes of optimal care. Okay, that's what the QAPI is. It's just a system that measures the significant outcome. The QAPI committee must use the measures in the care of planning and coordinating services and events. The measures must include the following and appropriate for the scope of services provided by your agency. Okay, you need an analysis of representation sample of services furnished by clients contained by both active and closed records. A review of negative client care outcomes. Okay, complaints and incidents, unprofessional conduct by licensed staff and misconduct by unlicensed staff, infection control activities, medication administration and errors, and effective and safety of all services provided, including the competency of the agency and clinical staff, the promptness of service delivery, and the appropriateness of agency response to client complaints and incidents. A determination that services have been performed as outlined in the individualized service plan, care plan, or plan of care, and the analysis of client complaint and satisfaction survey data, and by annually evaluating of the total operation, including services provided under the contract agreements. Okay, so this QAPI thing is big. You know, it's pretty much the Texas Administrative Code tells you what you are and how you need to set this up, and it talks about who is responsible for this, and it is a result of all the day-to-day operations and things that has happened. How can you improve it? What have you put in place? What have you reviewed? And you just have to have a whole documentation of your day-to-day operations, just outlining and notating negative outcomes. Okay. Okay, with any negative outcomes, the HHSC wants you to document these things. Okay, so you should have a binder that you have set up in your agency to where you are keeping track of all of this, assessments of yourself, your negative outcomes, and you're keeping this document. If you look in the Texas Administrative Code, it says QAPI documents must be kept confidential and be made available to HHSC staff upon request. QAPI committee members, at a minimum, the QAPI committee must consist of the administrator, the supervising nurse or therapist, or supervising advisor of the agency licensed to provide personal care services, an individual representing the scope of services provided by the agency. And the frequency of QAPI committee meetings, the QAPI committee must meet twice a year or more often if needed. Okay? So they have an outline for you here in the Texas Administrative Code on what the expectations are for the for your QAPI program as an agency, how to document it, where to keep it, who's supposed to be on that committee. Okay? So let's talk a little bit about the definitions of some of these keywords when it comes down to QAPI. We have performance improvement, PI. Okay? PI, also called quality improvement. It is a proactive and continuous study of processes with the intent to prevent or decrease the likelihood of problems by identifying areas of opportunity and testing new approaches to fix underlying causes of persistent systematic problems. PI in home health agencies or nursing home aims to improve process involved in healthcare delivered and resident quality of life. PI can make good quality even better. Okay, so that is PI. Okay, performance improvement. Let's talk a little bit about PIP, performance improvement projects. A PIP project typically is a concentrated effort on a particular problem in one area of the facility, home health agency. It involves gathering information systematically to clarify issues and problems and intervening for the improvement. PIPs are selected in areas important and meaningful for the specific type of scope of services uniquely to your agency. Okay? Let's talk a little bit about QAPI, quality assurance and performance improvement, what the definition of it is. It is a data-driven, proactive approach to improving quality of life, quality of care, quality of services. Okay? Then we're going to talk about quality assurance, QA. Quality assurance, QA, is a process of meeting quality standards and ensuring that care reaches an acceptable level. Okay? Root cause analysis, RCA. Root cause analysis is a term to describe a systematic process to get to the underlying cause of the problem. Okay? Systems and thinking. Systems thinking is a perspective that considers how things influence one another as a whole rather than individual elements or static snapshots. Okay? So those are just some definitions when it comes down to QAPI that you need to get yourself familiar with. And we're going to go farther into actually seeing how this all comes into play in our next couple videos when we get ready to move forward to our next couple videos for QAPI. Here are the 5 strategic elements that are basic building blocks to an effective QAPI. Okay, so you have your foundation: quality care, quality life, quality services, quality resident choice. Number 1, we have the design and scope. It's described inside of the Texas Administrative Code 558.237. Number 2, governance of leadership. Okay. Block number 3, feedback, data systems, and monitoring. Block number 4, performance improvement projects. Block number 5, systematic analysis and systemic actions. Okay. The 5 elements are your strategic framework for developing, implementing, and sustaining your QAPI. Your QAPI plan should address all 5 elements. The elements are all closely related. You are likely to be working on them all at once. They may all need attention at the same time because they will all apply to the improvement initiatives you choose. Okay? Your plan is based on your own program of services, the needs of your particular clients, and your assessments of your current quality challenges and opportunities. Okay, so these are the 5 building blocks. Like I said, you could all work on them all at the same time. They may all need to be addressed at the same time. This is just the foundation of your QAPI program and how you need to keep it in order and follow these strategic building blocks. Okay. Um, we're gonna go more into this in our next video. Um, but this is very important that these are the blocks, the strategic elements and building blocks of your QAPI program.